In this video, we will discuss about Streptococcus pneumoniae. Morphology. They are gram-positive diplococci which are lanceolate shape. That means flame shape. They are capsulated, non-motile, non-spore forming organism. This one is aerobic and facultative anaerobic organism. In aerobic condition, they are producing alpha hemolytic colony, and anaerobic condition, they producing beta hemolytic colony on blood agar medium due to oxygen liable hemolysin O. They are fastidious organism. That means it grow only in enriched media. Very important point. This Streptococcus pneumoniae. There are sensitive to optosin. Optosin is a antibiotic. They produced a wide zone of incubation. This property differentiate other Streptococcus. So here important point, this one is optosin sensitive. Other antigens, they include, first one is nucleoprotein which is present deep inside the cell. Second one is somatic C carbohydrate antigen. Third one is C reactive protein which is acute phase reactant produced in the hepatocytes. Toxins and other virulence factor. First one is capsular polysaccharide which is acidic and hydrophilic. Then pneumolysine. This is immunogenic. This pneumolysine is membrane damaging toxin. This is cytotoxic and also complement activating property. Third one is autolysin. This is virulent by releasing bacterial component in the infected tissue. So these are the other virulence factors. Toxin and other virulence factor, capsular polysaccharide, pneumolysine and autolysin. Next one is pathogenicity. Streptococcus pneumoniae can infect human nasopharynx, middle ears, paranasal sinus, respiratory tract and meninges. It also causes bacteremia through which infection spread to the heart, peritoneum and joints. This bacteremia occur in early stage of lobar pneumonia. Infection can lead to lobar pneumonia, acute tracheobronchitis, empyema. Empyema means packet of pus that have collected inside body cavity. Then bronchopneumonia. This is the terminal event. So it causes infection. After that it will causes bacteremia. Then it will affect that lobar pneumonia. Then it causes finally it causes bronchopneumonia. This one is the terminal event. Let's see how bronchopneumonia is caused. First, the primary infection which is damage the respiratory epithelium and causes excessive bronchial secretion which progresses into secondary infection of lungs, bronchopneumonia. Then it is commonly associated with chronic bronchitis because in chronic bronchitis the copious respiratory secretion which help pneumococcal invasion. Then second one is meningitis. Meningitis can occur secondary to other pneumococcal infection like pneumonia, otitis, sinusitis and conjunctivitis. Then suppurative lesion, that means first formation. It included empyema, pericarditis, otitis media, sinusitis, then conjunctivitis, then suppurative arthritis, peritonitis and ocular infection. Epidemiology. Streptococcus pneumoniae present throughout of approximately half of the total population. Half of the total population, it is presented in throat. But the manifest, the disease occur only when the host resistance is lowered by the factors like respiratory viral infection, pulmonary congestion, stress, malnutrition, immunodeficiency, alcoholism, splenectomy, and sickle cell anemia. Streptococcus pneumonia type 3 is the most virulent strain. The commonest infection caused by Streptococcus pneumonia, otitis media and sinusitis. In adult, type 1 to 8 are more common. They causes 75% of pneumococcal pneumoniae. In children, type 6, 14, 19 and 23 are common. Next one is laboratory diagnosis. First one is specimen collection. Sputum, CSF, blood for culture and urine for antigen detection we are using. Then microscopy. In acute phase of lobar pneumonia, that sputum grams stained, it show large numbers. Then culture, blood agar medium, alpha hemolytic colonies. Fourth one is mouse inoculation. This is done if bacteria are scanty, that is very few. Then antigen detection. In the case of meningitis, antigen detection done by culture. Then diagnosis demonstrated specific soluble substances in CSF by precipitation with antisera or lactose agglutination test. Next, capsular polysaccharide. These are demonstrated in blood, urine, CSF by counter immunoelectrophoresis. Next, immunochromatography. This is done by detection of polysaccharide antigen in urine. So, laboratory diagnosis, specimen collection, microscopy, culture, mouse inoculation, antigen detection, immunochromatography technique. Biomarkers. This include testing of CRP, C-reactive protein testing and procalcitonin, which is increases in invasive pneumococcal disease. Procalcitonin, which is increase in invasive pneumococcal disease. Next one is molecular method, which include PCR based method. Next one is biochemical method. Catalase and oxidase test negative. Sugar fermentation. It can ferment sugar, but only acid production, no gas production. Next, fermentation of inulin. This test is seen in Streptococcus pneumoniae. This one will differentiate from other Streptococcus. So, this inulin test will differentiate other Streptococcus. Then, bile solubility test also positive. Bacteria are lysed. Next one is treatment. Drugs of choice. In the case of mild cases, amoxicillin. In the case of severe means parenteral penicillin. For drugs resistant Streptococcus pneumoniae, third generation cephalosporin are used. So treatment purpose amoxicillin, penicillin. Now we will see the notes format. Thanks for watching.